The next cataract we are going to study is congenital cataract. Okay, and ectopic lentis and some miscellaneous things about the lens. So starting up with congenital cataract. The types of congenital cataract. There are two types of congenital cataract. These are infantile congenital cataracts and developmental congenital cataracts. Now, infantile cataract. It is visible at birth of before 1 year of the age. Okay, so it is visible at birth before 1 year of her age. This is the visibility of the infantile cataract. Now, severe loss of vision is there, and as the interference with the development of facial fixation. So there is a interruption in the facial fixation development that leads to infantile cataract. Okay, it usually occurs 3 to 4 months of the age. Okay, so usually it could be seen, the signs and symptoms should be seen 3 to 4 months of the age of the child. Now, in developmental cataract, okay, so developmental congenital cataract, it is visible after 1 year of age. Remember, here it is visible before 1 year of the age, and here it is visible after 1 year of the age. Now, there is a minimum loss of vision. Here it was a severe loss of vision, and here it is minimal loss of vision. Now, the types of cataracts. Okay, what are the types of cataracts? So it could be a blue dot cataract or punctate cataract. Okay, now a blue dot cataract, it is the most common cataract. Okay, it is the most common congenital cataract. Now, the most common developmental cataract is also the blue dot cataract. Okay, so the most common congenital and developmental cataract is blue dot cataract or punctate cataract. It is associated with Down syndrome. Very important point. Okay, it is associated with Down syndrome, and it consists of both the cataracts. Okay, it is an example of both the cataract. Now, the second cataract comes over here is laminar cataract, or you can tell it as a zonular cataract. Okay, so laminar cataract or zonular cataract. The most common infantile cataract, remember, the most common infantile cataract is laminar cataract or zonular cataract. Okay, now it is associated with congenital rubellar syndrome. Okay, here it was associated with Down syndrome, here it is associated with congenital rubellar syndrome. And the most common cataract in congenital rubellar syndrome is nuclear pearling cataract. Okay, so nuclear pearly cataract is the most common cataract in congenital rubellar syndrome. Now, what other causes it could be associated with? These are vitamin D deficiency, and it is an autosomal inherited condition. Okay, laminar cataract or zoonotic cataract. Now, what all clinical features we can see in this cataract? These are opacity affecting in the fetal nucleus. Okay, obviously it is in fetal condition, and it is affecting fetal nucleus. Okay, so point here to be remembered is the nuclear part of the fetal is being affected over here. Okay, nuclear part of the lens in the eye. Okay, now spoke like opacity is seen, and this is called as redders. Okay, let us see an image in which spoke like opacity called as redders are observed. So here you can see these are the spokes like opacities, which you can clearly see over here. Yes, spoke like opacities, these are redders. Okay, now after laminar and blue dot cataract, the third comes is posterior polar cataract. Okay, posterior polar cataract, also known as onion ring or whorl appearance cataract. Okay, so clearly you can see a onion ring like cataract, okay, having a several multiple rings, or it could be called as a whorled cataract, whorled appearance cataract. Okay, this is posterior pole cataract. That means this cataract is located at the posterior pole of the eye, and it is associated with Middendorf's dots. Okay, you can see Middendorf's dots over here. Then it is associated with persistent hyperplastic primary vitreous. Okay, so hyperplastic primary vitreous, this is persistent over here, and it could be associated with PITX3 gene mutation. Okay, now what is the treatment for congenital cataract? The treatment is surgical options. Okay, so surgically we can treat the congenital cataract. Okay, so basically in surgery what we are going to do, we are going to perform a ECCE surgery. Okay, so basically in ECCE surgery we are going to aspirate the lens. Okay, so the lens is aspirated, the posterior capsulectomy is done, because the major complication which is going to come is posterior capsular opacity. To avoid this complication we are going to cut the posterior capsulectomy. Okay, so we are going to do posterior capsulectomy to withdraw the posterior capsular opacity syndrome. Okay, now the anterior vitrectomy is also done, and IOL implantation is done. Okay, we have studied this before. Now usually it is done before the second year of the age, so this is done at the second year of age, and completely this full surgery is known as ECCE surgery. Okay, so lens aspiration, posterior capsulectomy, anterior vitrectomy, and IOL implantation. Now let us see the IOL implant. What power are we going to use in different children's in different age groups? So IOL power in children, this is less than 2 years, or it could be 2 to 8 year of a child. So in less than 2 years of a child, it is under corrected by 20% by IOL powers. Okay, and in 2 to 8 years of child, it is corrected by 10%. Okay, now the time for congenital cataract surgery is unilateral dense. So unilateral dense, this would be immediately surgered. Okay, and before 4 to 6 weeks of the age this surgery is done. Now the unilateral partially, it is, if it is unilateral and partially, then we are going to do anti amblyopia occlusion therapy. We are going to give this therapy to the patient suffering from unilateral partial vision loss. Okay, if there is bilateral dense vision loss, then surgery would be performed by 12 weeks. Okay, 12 weeks of the age. Now bilateral or partial, then again defect till 5 years. Now the next comes is the ectopic lentis. Okay, now what is ectopic lentis? So it refers to as the displacement of the lens from its position, and this is nothing but ectopic. The name itself tells us ectopic means from the normal position something has been displaced. here that something is lens, so called as ectopic lentis. Okay, now what are the causes of ectopic lentis? The most common cause is blunt trauma. Okay, very important. Now other causes: hyper mature cataract, aniridia. Familiarly, it can be due to autosomal dominant disorder. It could be associated or caused by Marfan syndrome also. Okay, so direction of the ectopic lentis is supratemporally. Okay, other ocular clinical manifestations are megacornea. Okay, now it could be associated with cornea plana, hypoplasia of dilated pupil muscle, axial myopia, lattice degeneration of the retina. Now, the next comes is homocystiuria. Okay, and the direction of ectopic lentis is inferior nasal. Okay, here it was superior temporal in the Marfan syndrome, and here it is inferior nasal. The deficiency of crystalline leads to zonular break. Okay, so the deficiency of crystalline leads to zonular break, and this leads to further loss of accommodation of the lens. Okay, very simple. Now the next comes over here is Will-Marchinson syndrome. Okay, and the direction of the ectopic lentis is anterior and forward. Okay, here it is anterior and forward, or it could be forward. So usually the patient have a short status, stubborn fingers. Okay, what else? So other it can be seen in hyperlysinemia. Okay, and it can be seen in sulfite oxidase deficiency. Okay, other it can be seen in Alanger Danglar syndrome. Okay, so Ehlers Danglar syndrome. Now what are the clinical presentation of ectopic lentis? So it could be superior ectopic lentis, like as you can see here is the lens. Okay, here this is your lens, and this is your ciliary zonules. Okay, these are your ciliary zonules associated over here. Now this sign is called as the pupillary area. Gold crest is seen. Okay, so golden crescents are seen at the pupillary area. This is the sign. What are the symptoms? So diplopia, there is a double vision, and monoocularly there would be a diplopia. Okay, now the next which comes is lenticonus, and it could be anterior lenticonus or posterior lenticonus. These are the two things. Okay, so it refers to the cone shaped lens. Okay, this refers to the cone shaped lens due to which it could be anterior lenticonus or posterior lenticonus. So the last one comes over here is micro spherophakia. Okay, the micro means small, sphero means it is spherical, and phakia means the lens. Okay, so it is characterized by small spherical lens. Now there is an increase in curvature of the spherical lens which leads to myopia. Okay, so there is increased curvature of the spherical lens which leads to your myopia. Now the next point over here it comes is due to small size of the lens, it can dislocate into the anterior chamber. Okay, as the lens is small and spherical, so it could dislocate to the anterior chamber also, and this dislocation to the anterior chamber can lead to secondary angular close glaucoma. Okay, So secondary angle closed glaucoma, this could lead to, okay, no. The equator in the visible in the pupillary area. So basically they are telling the equator, the center line passing that we studied, that will be visible in the pupillary area. Okay, the center line would be now visible at the pupillary area, and it is usually associated with a syndrome known as Wills-Marchinson syndrome. This is the syndrome it is associated with. Okay, the next and the very most important topic of ophthalmo, glaucoma.